that we became so vulnerable to that there were very few or almost no exceptions in the black community to start raising hard, critical questions about what was happening to us in this experiment? Or does it say that in the training of black doctors, that they bought into the value system of the white medical profession? That you don't critically raise hard questions about colleagues of what they are doing. There are letters and there's information in the papers, and I'm in the process of doing a major book on this in terms of ethics, but there's information in the papers that show that the people here in this community, they knew what was going on in that study. They knew that. It's in the records. The documentation is there, the letters that were sent to the president's response, etc. Now, was it that they knew and did not see this as threatening, or what was going on? I think these are hard questions that we have to raise even at this period to these documents. If we don't raise them, we stand to repeat and make ourselves subject in this generation. We really would do young people a disservice, because they're going to be in a lot of situations where decisions are going to be made at the top. And if we say to them, these people at that time had no authority, I challenge that. They had moral authority. Now, in a segregated society, I realize how limited moral authority would be, having been reared in a segregated society, but I saw blacks as a boy who stood up against the system and even put their own lives and family at risk. And the community helped to get them out, sometimes in a casket, but they still stood up in order to save their lives, but they still dared to stand up and let somebody know that we saw something that wasn't right. Now, I think the challenge is, for Tuskegee and everywhere we train youngsters, or teach, is to challenge them, to what extent will you give up your moral authority for a job? I think that's the challenge. And I think we need to be bold enough to discuss it, because if we're going to give up our moral authority to keep our jobs, then we believe that we live by bread alone. The other part of the story is, I think Professor Parris is so right in terms of that brilliant analysis of what is happening in the larger society, character development, racism, and the way it shaped our understanding of character development. But I think the other side of the story is that the epic center for this, and all the papers, the thousands of papers up there in Atlanta that the CDC turned over to the federal government indicate this. That the other part of the story is that, yes, the policy decisions about this study were made in Washington. That is true. But this study was also had an interstate commerce dimension to it. Now, what do I mean by that? The studies show that as autopsies were being performed on the bodies, the body parts of the black men who died were sent to Washington by train. The hearts were taken out of the men, et cetera, and other organs, put on trains, put under refrigeration, I guess, obviously, and shipped up to Washington to be studied by the health department or the powers that be in Washington to make judgments. And the documents are there in up there in Atlanta, showing they write back the reports, long, exhausting reports of what they found, et cetera, et cetera, et cetera, et cetera. It was a study in seeing what would happen if you don't treat these men. That's what the study was. Now the issue is for me is how could all of this have gone on all of those years and nobody ever talked about it in the black